Good evening and thanks for joining us for 41 NBC News at 5:30. I'm Shelby Coates.
And I'm Tucker Sargent. Our top story tonight at 5:30. It is still unclear what causes long COVID, but a new study published in the Nature Communications Journal might help scientists develop a blood test that could help determine a person's risk for developing it.
That's right. According to the Centers for Disease Control, long COVID is when symptoms last weeks or even months after initially being infected with COVID-19. So we spoke with an infectious disease physician at Piedmont MACON about the study. She says it found that people who had higher levels of COVID in the bloodstream and people with underlying conditions were among the types of people more likely to develop long COVID.
The trouble is that we don't really have a clinical test to easily measure the level of COVID in the blood. If you could develop that, then maybe you could say that people with higher levels of COVID in the blood ought to be prioritized for antiviral treatment, and maybe that would be helpful.
Dr. Hoffman says the information is preliminary and needs confirmation from other studies. Also, she says vaccination is still your best defense against COVID-19 and potentially developing long COVID. You can go to vaccines.gov to find a vaccine location near you.